And welcome back to the Morning Blend. Today, help so that you can put your breathing problems to rest. We have simple in-office solutions for stuffy noses.
Dr. Hilel Swerdlin is an ear, nose, and throat surgeon, and he is here with more on what can be done to get you to breathe through your nose again. Good to see you, doctor.
See you.
Good morning.
I think a lot of people who have a stuffy nose chronically have just sort of accepted it. What causes it? Why is a nose constantly stuffy or obstructed? Why does that happen?
Well, there's three reasons. One of them is a structural reason inside of the nose, either a deviation of the septum or enlarged bones or cartilage in the septum. The other reason would be a problem with the lining of the nose. The lining of the nose can get really swollen if you have allergies, if you have a cold, or if you have a chronic sinus infection. And the last reason is if something is growing in your nose. Now, don't be alarmed. but for example, polyps can be growing in your nose. You can have large adenoids in the back of your nose, or sometimes we see tumors in the nose. Rarely, but we can see tumors in the nose. Those are the three main reasons.
Well, and I think Tip's right. People kind of just accept it. They think, well, it's always going to be like this. It's always been like this, so why would I expect anything different? So what can a patient expect if they come to your office and they're evaluated for a stuffy nose?
Well, we say hello, make them feel at ease, and then what we do is we ask them questions, exactly what's going on with their nose. And then we do a little bit of detective work. We look inside of the nose with a tiny little telescope. We actually make a video of the nose so we can share the findings with the patients and better explain what the problem is. In case they have allergies, we're able to do an allergy test. And in many instances, we do a CAT scan of the sinuses also.
So all the CT and the allergy testing you do in office, you don't have to refer someone out for that?
Yes, we do everything in the office. Our CAT scan is very special. It's very low radiation, less radiation than a dental x-ray. And it actually generates a GPS map that we can use if we need to do GPS surgery, which makes the procedure significantly safer and simpler.
High tech. So what kind of treatments then do you offer?
Well, we offer all the treatments for nasal obstruction. The simple medical treatment, and we start with medical treatment first. If they have a sinus infection, we give them an antibiotic. If they have allergies, we treat the allergies. You can actually treat the allergies over the counter nowadays. So you can save a step and try the nasal steroids, the nasal antihistamines, but we treat the allergies. And then if they need to have anything done in the nose, we use the GPS surgery that I was telling you about. And most of the time, it can be a very simple procedure, an office balloon dilation. If we need to do something to the turbinates, we can shrink them down really easily. We can shave polyps or vacuum polyps. We can fix broken noses. We can even remove little humps from people's noses if they need to. We're able to fix the septum, fix the nasal valve, remodel the airway. Basically everything. We can do everything in the office.
That's a lot. Do you put people out, or is there some sort of anesthesia that you give?
That's a very good question. Every patient is different. Some patients don't want to be put out. Some patients don't want to know anything about it.
Yeah, I don't want to know anything.
Some people don't want anything.
I don't want to remember a thing.
So we have all the options. For the simple balloon procedures, we typically just use a little gel that numbs everything up, and then they don't feel anything. But we have the ability to give sedation, and there's the variety of sedations. There's the laughing gas, which I really like.
I like that too.
It's wonderful because you can drive yourself. You can drive yourself to the procedure, and then 5 minutes later, the laughing gas is gone, and it really relaxes you. My daughter had a dental procedure. She was 5 years old with the laughing gas. She had the best time.
Yeah, me too.
So we do the laughing gas. We have the ability to also do IV sedation or general anesthesia. We have all the ability to do all the procedures with any type.
What's the recovery like? Because some people have heard about the packing the nose. It's kind of an old-fashioned way
My mom had that done.
of treating the sinuses after surgery.
Well, thanks to the GPS surgery that I'm telling you about, and thanks to the advances in surgery, and also thanks to the fact that I've been doing this for just about 25 years, so I've gotten a little bit better with time. The recovery is pretty quick. It's either the same day or the next day. We do not use any packing. So it's very quick recovery.
Is it true, because we said this earlier, that you give your cell phone, your personal cell phone, to patients?
I do.
Why do you do that? I'm just kidding.
Well, my mission statement in life is to treat others like I would like to be treated.
I would like that as a patient.
And we extended that to our office. As a matter of fact, the name of our office is ENT Family Clinic because we always have treated our patients like family. And wouldn't you give your cell number to your family member?
I would.
That's wonderful.
The other reason I do it is because sometimes when the patient has a procedure, they want to make sure that they're doing fine. So nowadays with technology, we can FaceTime. Or now there's an app for Google Android phones that you can Google Duo, so you can also see each other, live and make sure that they're okay. You can reassure them. So they have a direct line with me.
That is
wonderful.
wonderful.
Nice.
And you do free screenings right now too,
Yes.
right?
We're doing an experiment. My office manager is probably not too happy that I'm doing free stuff, but we are doing a little experiment. I want to see anybody who cannot breathe through their nose. I'm going to see them face to face in the office for a free screening. I don't know for how long. They're just going to let me do it, so hopefully.
It's wonderful, though.
Yeah, so you better take advantage now.
That's right.
Yes, because I think it's true what Tiff said. People just get used to it, and they just think, oh, my nose is always going to be like this. It's never going to get better. So you can tell people, here's what I can do to fix your breathing problems, your stuffy nose.
That's right. And many times fixing the runny nose is going to help with snoring.
Yeah.
Of course, there's a lot to talk about snoring. Maybe another time you'll have me to talk about that.
That'd be great.
I think that's wonderful.
Thank you so much.
So here's the deal. This only lasts for a little bit till his office manager gets mad. There's free screenings right now at Sinus and Snoring MD. The phone number to call is 262-652-2887 for that free screening. He wants to see everybody who's got a stuffy nose. SinusandSnoringMD.com so that you can schedule. You can also schedule online as well, but that's how you do it right there. Thanks so much for being here,
Thank you so much.
Right,
Thank you. It's a pleasure.
Thank you.